This is breaking news.
The city, the greatest city in the world, is 400 years old. This hospital is almost 289 years old. And so it's with my distinct pleasure to introduce you to our 110th mayor of this great city, Mayor Eric Adams.
Thank you. Thank you. Thank you so much, Doctor, and the entire Bellevue team. I recall my days of policing. We would use this facility so much. They do so much every day. And during COVID and other major incidents, this was really a focal point for the entire city. Dr. Katz and the entire H&H operation. Oftentimes, we don't realize how much the team members behind us and those who are on the side, how much they contribute to the city. And we just want to personally say thank you for the work that you do. And that work is really highlighted in what you do around those with severe mental health illness. As we think about it, and many of us have forgotten, but I have not, almost 3 years ago today, Michelle Go, a young, promising New Yorker, was shoved to the subway track, and we lost her. I will be speaking with her parents later today, as I often do during this time, because although the time may move forward, the pain does not dissipate. It still reminds you each time you have to think about what took place. And far too many New Yorkers are dealing with severe mental health illness. And we made a commitment when I took office. For far too long, we were walking past them, acting like they don't exist, allowing them to sleep on the side of the highways and allowing them to sleep in our subway stations and in our streets. And we just act like everything was fine. I refused to do that. And we received a lot of pushback when we stated that we would not allow our city to become a city where encampments would define us as a city. There's nothing dignified about allowing someone to sleep on the street, someone to sleep in the subway system. And no matter how much noise people put in place, telling us that it could not be solved, we refuse to surrender, we refuse to submit. New Yorkers don't submit. We solve problems, and that's what this administration made clear. The team members here, under the leadership of Deputy Mayor Williams-Isom and Molly and Dr. Katz, and our entire operation has been focused on this issue. We brought on Brian to help us become smarter in this place. Homelessness did not start January 1st, 2022 when I became the mayor. Let's be clear on that. Administration after administration after administration have been trying to tackle not only this local problem, but national problem of homelessness. Go Google other cities and see the encampments lining the streets, how people are living under roadways and pathways and highways. You don't see that here in this city because our North Star is not to allow that to happen. No matter what people are saying, we are moving forward in real result. Government has failed to care for and to help those who are unhoused New Yorkers, but this administration refused to surrender. Through our subway safety plan, we doubled the number of outreach staff working with unhoused New Yorkers. We reached over 8,000 New Yorkers and helped over 2,800 move into permanent affordable housing. Think about that, 2,800 of our fellow New Yorkers who have fallen on hard times are no longer living in our subway system. They're living in permanent housing. And when I took office back in January, February 2022, and I went into the streets and I talked to people who were living in tents, living in encampments, when I looked inside their tents, I saw human waste, drug paraphernalia, schizophrenic, bipolar, stale food. I saw people who just really surrendered. And one of them was a retired police officer that found himself just living on the street. Everyday New Yorkers were living on the streets, and we were walking past them. And 2,800 of them, this team was able to get off our subway system. A key part of our subway safety plan the PATH and SCOUT programs, which bring together law enforcement and trained clinicians to do cold response in the subways. Since our PATH program began last year, our teams have made contact with over 7,400 unhoused New Yorkers and delivered services to over 2,200 people. When you talk to these team members who are here, part of initiatives like this, they would tell you the challenge and the difficulty of getting someone off the system and off the street when they don't know they need care. That is a challenging task that you must build trust, build community, and continuously engage in interacting with them so that they can realize that they need the help that they deserve. And we know we have to do more. There's more work to be done. This is an endless cycle because each time we pull people inside, there's another group that goes back outside, but we're going to be committed. And today, we're announcing further details on a historic $650 million effort to address homelessness that includes $620 million invested directly in street homelessness and support for those with severe mental illness. This administration, we have committed the largest annual investment in serving street homeless in the city's history. And we have more than doubled our street programming budget from when we came into office, the largest in the city's history. We're excited to unveil the new Bridge to Home model that will meet New Yorkers where they are and provide a supportive facility that gets them the treatment and temporary housing they need while keeping them out of the hospitals and off our subways. Really hats off to Dr. Katz and Brian and the team from hearing from their on-the-ground workers that this is something we must do, and we're going to put the money to get it done. And we know New Yorkers cycle between hospital and homelessness. Those of you who use our public subway system and our other systems of transportation, you know you see the same individuals over and over and over again. Our goal is to give them the trust they need to come inside. And we're here at Bellevue Hospital, one of our great public hospitals, which treats people experiencing street homelessness every day. Many of these people come back again and again and again. They see the revolving door. We know how much personal trauma this is to all of us to experience watching people go through this over and over again. And so the new facility will provide a safe space for New Yorkers with mental illness to live, to heal, and be cared for so they get the life-changing help they need. It will also help reduce unnecessary emergency room visits and inpatient hospitals. If we don't get people off the streets that are dealing with medical issues, diabetes, heart disease, asthma, they end up in the emergency room. That just does not make any sense. And our goal is to stop that cycle of homelessness. It would also help reduce unnecessary issues that they would face, and we would decrease street homelessness and reliance on shelters and lowering interaction with the criminal justice system. We cannot have a system where 51% of Rikers Island inmates have a mental health issue. 20% have a severe mental health issue. The real crime is not only what they committed on the streets, but the criminalization of our failure to address their issues beforehand. We also know that safe haven beds are one of the most effective tools we have for helping people on the subway system. We know we can do better. And consider this, our administration has moved 2,800 people from safe haven and stabilization beds into permanent, affordable housing. So we're going to add 900 safe haven shelter beds and 100 runaway and homeless youth beds to our system. That's an increase of over 1,000 street beds that we know are in high demand that are highly effective. These facilities offer services to meet basic needs such as shelter, employment, food, and clothing, and sometimes severe mental health support. And we know that people experiencing homelessness are much more likely to accept even a baby is cheering today. And we know that people experiencing homelessness are much more likely to accept these safe haven beds when presented the option. We know these beds work. That is why we're going to continue to lean in this area, and that is the right thing to do, the compassionate thing to do. And I've seen both sides of this issue, living on the verge of homelessness as a child. I know what it is not to have housing stability, how it impacts. And if a child grows up in a homeless shelter, they're less likely to graduate from high school. If you don't educate, you will incarcerate. And we have to stop the pathline and pipeline of incarceration. And so I'm pleased here and to hear from the governor yesterday, who shared our vision and our commitment at her State of the State address. She talked about some of the common sense solutions we've been advocating for to help people with severe mental health illness and close many of the loopholes in our system. Finally, this issue is placed front and center in this state with the leadership of the governor. And so today's historic investment and eventual changes to state law, we're going to reach many more New Yorkers in need. Keep our city safe and protect our fellow New Yorkers. They deserve better, and we're going to give them better. Thank you, and I want to thank the team behind us on the work that they do. They're unsung heroes. Oftentimes we don't see the work that hospitals like Bellevue and the entire team here, but we acknowledge their presence every day. And I want to turn it over to my good friend, Dr. Katz.
Thank you so much, sir.
This has been breaking news.